As we speak here, we have healthcare workers who on the 9th of every month can't access care because governors have not sent money to SHA, SHA has locked them out. So you offer services that you can't get yourself. As we sit here, people are on strike because certain counties, after Ministry of Health availed 8.6 billion to absorb UHC workers, the counties refuse to take them. So we must discuss, yes, we must discuss as a country, and I really read your manifesto back to back. You say that you have felt the pain of the healthcare worker, and you promise to be a neutral arbiter without compromising devolution. And this beyond 2030 discussion, we must let Kenyans decide, are they happy with how health is being run in this devolved system or not? We are not fighting devolution. We are not fighting devolution. But why can't we let primary healthcare, level 1, 2, 3, be run by the counties? Then the complex, expensive 4, 5, 6 be run by the Ministry of Health. So that if the counties fail, then the 4, 5, 6 is working. If the 4, 5, 6 fail, then the 1, 2, 3 is working. To give Kenyans a reprieve. That's all that we're asking for. Make careful.
So first of all, to respond to my brother and my boss, Honorable Sakaja, it's true. I'm Dr. Dennis Miskela, the Deputy SG for Kmpdu, the Doctors Union. It's true that we come from Kenya. Even these healthcare workers are Kenyans. So we know we come with our weaknesses, that in this sack of healthcare workers, there are rotten apples. And as Kmpdu, we never shy or defend when healthcare workers make mistakes. We also fall sick. So we know that sometimes that motivation to get that extra money through all those bad ways are there. But then again, as healthcare workers, we will also not sometimes allow ourselves with the punching bag that when there is no drug, wameiba madawa. When the machine is broken down, wanatuma watu nje kupata hizo pesa. Sometimes genuinely those equipment break down. Sometimes genuinely those drugs run out. So let us not punch the healthcare worker. They really go through so much to help. But what I can say that, please, can we have a proper feedback mechanism where the citizens themselves can report? Because even this debate, Your Excellency, about SHA not working, is not because SHA is not working. It's because somebody has paid for SHA, but when they go, apart from the consultation fee, they have to buy drugs outside, do ultrasound outside. They get frustrated. So what do we do instead? Why can't we have a setup where the governors can promise this summit that drugs will always be available? Not every time you see a lorry bringing cartons, they are bringing the drugs that we asked for. If you could ensure that when a patient walks in through the hospital, and I'm glad that DHA has put that system, that when you walk in to when you walk out, you don't pay for anything or buy anything outside. But to expect citizens to come and pay for SHA, then everything else they buy from outside is a problem. But as I move to something else, that right now the healthcare worker is the most demotivated cog in the UHC. Why do I say so? Because on the pillars of the UHC, there are certain things. Financing is one of them, and SHA is doing a pretty decent job on that, I won't lie. We have negotiated the US government deal funding around the HIV and TB. Perfect. Financing, we are doing a good job. On the issues of KEMSA reforms, 80%, 90% fill rate, perfect. We are doing a good job on that. Infrastructure right now in this country, within 5 kilometers, there's a hospital. And we just saw a deal of 13 hospitals, 300 beds being done in almost 13 counties. A decent job. ICT and record keeping, good job digitization. The biggest challenge that we must face is the human resources of healthcare. As we sit here, 33 counties have not paid salaries. That's a fact. And they have to pay rent still and go to work with fuel. As we speak here, we have healthcare workers who on the 9th of every month can't access care because governors have not sent money to SHA, SHA has locked them out. So you offer services that you can't get yourself. As we sit here, people are on strike because certain counties, after Ministry of Health availed 8.6 billion to absorb UHC workers, the counties refuse to take them. So we must discuss, yes, we must discuss as a country, and I really read your manifesto back to back.
You say that you have felt the pain of the healthcare worker, and you promise to be a neutral arbiter without compromising devolution. And this beyond 2030 discussion, we must let Kenyans decide, are they happy with how health is being run in this devolved system or not? We are not fighting devolution. We are not fighting devolution. But why can't we let primary healthcare, level 1, 2, 3, be run by the counties? Then the complex, expensive 4, 5, 6 be run by the Ministry of Health. So that if the counties fail, then the 4, 5, 6 is working. If the 4, 5, 6 fail, then the 1, 2, 3 is working. To give Kenyans a reprieve. That's all that we're asking for. Make care for us, the healthcare workers, so that we can care for the patients too.
These union people, because you spend a lot of time with them as governors, navigating these matters. But the things said here should not take away from what counties have been able to achieve in this sector. This morning when we were in the other hall there, we took cognizance of the fact that in 2013, in the run-up to the first elections, under the devolved system of government, we had about 900 doctors in district hospitals. Today we're talking of close to 5,000 doctors in county hospitals. Your Excellency. Your Excellency, you very well know that I'm a returnee governor. I served in the first term. I was out for 5 years and I'm now here. I inherited Wajir with one doctor. I think that one doctor is here. Dr. Somo, I don't know whether he's here. He was in the hall today. Today we have over 70 doctors, of which over 20 are specialists. I remember advertising for a consultant 3 times, and no Kenyan was interested to come and work in Wajir. And I went and sat in the office of General Kaiseri, and I said, you need to give this Ethiopian doctor a work permit because he's a consultant. I can't find a Kenyan consultant. And that Ethiopian doctor was the only consultant in my county for years until we sent our own doctors to go and specialize and become consultants. He died in a road accident. He's called Dr. Zanai. People know him in the medical profession. So the things people say here about counties and devolution are not, it's not what it is, Your Excellency. Your Excellency, there are things, I think this reaction, first of all, emanated from what Governor Sakaja said about people being sent to private facilities, and I'll respond to that last. It is true, Your Excellency, and I said it here last night. Since you came into office, we have not had instances of crossing over and merging finances of one fiscal to the other. It was very ordinary in the past for June allocation to be paid in July or in August. We have our June money. We have our July disbursement. But there is another matter, Your Excellency, of the treatment by independent officers and commissions, and especially the matter of COB with respect to county governments. We have asked for an IBEC, which His Excellency the Deputy President chairs, and IBEC will happen on Monday. This will be one of the issues that will be discussed. As for those counties that are yet to submit a budget, Your Excellency, those are the vagaries of democracy. Budgets are drawn by the executive, but they're approved by the county assemblies. And sometimes they take their time. And they sometimes, you know, and we don't meet certain deadlines. But the financial architecture has taken care of that. Even when a county has not passed a budget, the law, PFM Act, allows that county to access 50% of the last year's budget within the first 6 months. So those are things that we will navigate. This particular incident here of 33 counties not being able to pay salaries, as I said last night, is just as a result of the fiscal year transition from one to the other. Once all these budgets are approved and uploaded into IFMIS, it happens once a year, so it will not be an issue. Most of the time in the past, it has been an issue of disbursement and releases of money. In this particular case, Treasury has disbursed. We are having crossover issues, which we will deal with on Monday with COB and at IBEC. Your Excellency, on the issue of CBS, as far as I'm concerned, Your Excellency, the only active issue, strike, which is not in all the counties. Nurses are not striking in my county, for instance. We have talked to them, and we are doing their promotions. We have promoted most of them. They have no issue, they are at work. But in some of the counties, I know nurses are striking. The CBA that they're asking us to enforce today, Your Excellency, and I can easily provide a copy to you, was signed in 2017. 2017. And when they came to see me, I also blamed their leadership. I said the clinicians came and formed a union after this CBA, and they still had their matters largely sorted out. If there are counties that have not signed, because we have already made that commitment at COG level, that's an issue you don't have to call a strike for. You just need to speak to me and tell me which counties. But, Your Excellency, this CBA of 2017, I asked the union leaders, how many chairs of council have been here? President Ruto was not even the president then. How many ministers of health have been here? You are raising it now. But the amount we're asking for is what was to have increased from 2017 to date, when a shilling has not increased. So we met as a leadership and we made a very good offer. And we also told them how we will move to where we ought to be. Given that nothing has moved, not a dime, from 2017 to date, and they are to come back to us on the offer that we made to them. As chair of council, I am determined to ensure that we have an understanding with the nurses. But I want to say here now that the CBA, which they are asking me to effect, was signed in 2017, and nothing had moved on it. Your Excellency, the question of whether health should be managed at national and county level is a constitutional matter. But I just want to give you an analogy, Your Excellency, because there's another elephant in the room, and that's the one of supervision. And Masakela is my good friend. Your Excellency, every time, because no sitting president of this country understands Kenya more than you do, because no one visits the periphery and every county more than you do. Whenever there is an attack of some sort, a bandit attack, an opportunistic attack by Al-Shabaab, in a place like Mandera, Wajir, by virtue of proximity to the boundary, teachers, some of whom are 300 kilometers from where the incident happened, come and demonstrate in front of TSC to be demanding to be taken out of the region. Yet the incident happened where? 300 kilometers. 300 kilometers between here and Busia. So it's something happening here, and somebody in Busia asking to be transferred out of Busia because of insecurity. Those are the shenanigans we will be dealing with if we go the way Masakela wants us to go. Counties have no problem managing healthcare. 5 or 6 of His Excellency's cabinet secretaries were governors managing counties. There is not a single governor today who cannot manage a docket at national level if he gets the opportunity from His Excellency the President. That is not the problem. The problem is systemic issues that we have to deal with, the approval of funding by COB and the like. Your Excellency, coming to the last matter, which is the matter of conflict of interest. Conflict of interest. And I know this is a very, very, and should I say, sensitive matter. Your Excellency, the problem you have in this country, which is a good problem, is that you are running a very democratic country. And democracy limits your hands in dealing with certain things, just the way it also limits my hands as a governor. We have a situation in our counties where doctors who have been trained with government money, some of